What do you think about this sixth edition of the event, and what is its importance for all specialists related to the field, the nurses, the ATI specialists, and the transplant specialist doctors?
Yes, I think it's a very good idea to have this meeting. It's now for the sixth time. I participated in all of them. And I think that people who are interested in transplantation medicine, whether it are nurses, doctors, or even students. Students is also very important to introduce them to the field of transplantation medicine, because one of the biggest problems is also to get people interested, but also educate them in the problems related to organ donation and transplantation, because as you have seen also from the slides, organ donation, the number of donors, is the biggest problem in organ transplantation. And that's why we have all these developments in living donation, living related, living unrelated, or altruistic donation, very good developments. But I think it's also very good to give this kind of courses also to medical students. So not only the people who are making their career in transplantation medicines, which is very important of course, but also for the students. So if I can be of any help for educating the medical students in Romania, I'm happy to do so.
Besides improving the number of donors, what would be the other most important step for the next generation of transplant specialists?
Well, that's a very difficult question, but I think the first point is indeed the number of donors. So if you look to, and I will tell that later also in my presentation, you can see a lot of differences in the number of organ donations per country in Europe. And it has to do with a lot of other things as well. For example, the legal systems. What is the legal system in Spain or in Austria? Presumed consent. Everybody is a donor unless he has objected and registered to be a non-donor. And in other countries like Germany and in the Netherlands, there you have the so-called permission. You have to give during life your permission, and if you didn't give it, then they have to go to the family and ask for permission. And the family will answer, oh, when he didn't give permission, then maybe he didn't want it. So you have to develop a lot of other things as well. It's not only educate the people, the population in the street, the mentality, but also the legal systems. And also the management in small hospitals. So it's not only a case of university hospitals or large hospitals, but also smaller hospitals. And not only for organs, like kidneys and livers, but also for tissue, like skin, cornea, bones, and so on, heart valves. Yes.